Hi everyone, and welcome back to my YouTube channel. My name is Priya Mistry and I'm a general dentist with a practice dedicated to taking care of patients with TMJ disorders. My practice is in beautiful Portland, Oregon, and I work with my mentor, Dr. Arthur L. Parker. Today's video is about what is myofascial release. Myofascial release. Let's break up the word. Myo means muscle and fascial means fascia. Fascia is a thin layer of connective tissue that surrounds the muscle, and this fascia has nerve endings in it that make it almost as sensitive as our skin. So it's a very sensitive tissue that surrounds the muscles. When muscles and the fascia around them become dysfunctional, usually due to overuse, poor posture over time, emotional stress, repetitive motions, or joint problems, it can then lead to myofascial pain syndrome, also called MPS. MPS is a chronic pain disorder that's caused by extreme constriction or tightness of the myofascial tissues. TMD, which stands for temporomandibular disorder or dysfunction, recognizes that there's a group of muscles that work together to guide and support the jaw. When these muscles of the head, neck, and jaw become dysfunctional, usually due to chronic clenching, chronic grinding, the way that we hold or posture our head, or if we have forward head posture or problems within the joints, it can lead to a variety of symptoms, but it can also lead to the muscles and the fascia that surrounds those muscles becoming too tight or too constricted. So TMD and myofascial pain syndrome are oftentimes very closely related and correlated and should be treated together. We use myofascial release in our practice as one of our many treatment modalities, and it's proven to be very effective. So myofascial release is a type of physical therapy that involves applying sustained pressure to the muscles and the fascia that surround them. When done properly, myofascial release stretches, lengthens, and smooths the overly tight and constricted myofascial system and allows it to function at its most optimal level. Myofascial release also stimulates blood circulation, which then brings fresh oxygen and glucose to the muscles. It also promotes fluid and lymphatic flow, which eliminates toxins that have built up in the tissue over time. Myofascial release can certainly be a little bit painful because we are applying pressure to areas that are already sore. So it's sort of like similar to kneading out a tight knot in your muscle during a massage. Similar to that. So it can be a little bit painful, but that pain works in our favor because it then signals to our body to release our body's natural painkillers, endorphins. These endorphins then help to prevent further pain impulses. So this then creates a cycle with fresh blood flow, with endorphins coming through, with good lymphatic flow that's happening and drainage and toxins being released and taken away, so that instead of having a pain and spasm cycle, things are allowed to heal. The vast majority of my patients say that it hurts so good when we do myofascial release. We do have some patients that say that it's sort of achy and sore there for about 24 hours after treatment, but ultimately we have very, very good results using this treatment modality in conjunction with other treatments, our orthotics, our jaw manipulation. There's a lot that we do here. One question many people have is, does insurance pay for a myofascial release? And the answer to that is sometimes, depending on your plan, and if so, it's usually billed as a part of physical therapy. So we do see it getting some coverage, yes. So my friends, I hope that you learned more about what myofascial release is. If you liked what you've heard or you've learned something, please click like below, subscribe to my channel, do all the things, share with your friends. There's so much more to come, and thank you.